First, thank you, Congressmember Garamendi, for all of your strong leadership and advocacy for us here in Contra Costa and on healthcare and social services. You've been an amazing advocate, so thank you for that over the years. I'm John Gioia, and I'm here with my colleague, Supervisor Scales-Preston, and we're both going to say a few words about what this federal bill means to residents here in Contra Costa. I have been on the Board of Supervisors since 1999. And in my 26 years, I have never seen this level of cuts and uncertainty on an important health system for our residents. As a county of a little over 1 million people, about 20% of the people who live in this county, about 200,000 people, get their health care directly through the wonderful and qualified staff here in our county health department, from our hospital and our 11 clinics. In fact, we have a proud history in Contra Costa of providing very high quality health care that residents deserve. In fact, our county health plan was the very first county health plan in the United States to be eligible for Medicare reimbursements. So we are proud of the history of providing this care. We are concerned that about 70,000 residents in this county could lose health care as the result of the federal ugly bill. What does that mean also to residents? Even those who may not lose health care but will have to wait longer for appointments. So individuals in this county will wait longer to get medical appointments, which means longer to get medical care, which also means longer to get treatment and more negative health and medical outcomes. It also means greater use of our emergency rooms, which affects everybody. When more people are using the emergency rooms, everybody suffers, even those who have health care, because they now have to wait longer times. It also means more cost to our healthcare system, which could translate to higher insurance rates. When you don't have health care and you delay getting the needed medical care that you deserve and require, you will be sicker. Potentially other people, if it's a contagious disease, will get sick. We saw during the pandemic that health really affects everybody and doesn't stop at anybody's doorstep. So it is so important for us to raise the visibility and fight these cuts over time, because they're being implemented gradually. The Republicans passed this in a way so some of these effects don't happen until after the midterm elections, because they know that people are going to be upset when those cuts happen. So we want to shine a light on those cuts and what it means for residents here in Contra Costa County. And we have our leadership from our health director to our chief medical officer to our social service director who are here, who can answer questions after. But I will turn it over to my colleague, Supervisor Scales-Preston, who also represents the area here where this hospital is located. I represent the west part of the county, where we have some of the largest number of residents who use our health system. So with that, Supervisor Scales-Preston.
Thank you, Supervisor Gioia, and thank you, Congressman Garamendi, for coming out to our beautiful hospital and coming out to take a tour to really understand the impacts that's going to happen here in Contra Costa County. As my colleague just shared, I have been part of the federal government for the past 23 years, working for two members of Congress, Congressman George Miller and then Congressman Mark DeSaulnier. In my 23 years, I have never seen cuts like this that's going to happen. And a couple of weeks ago, I was just talking to someone, because I serve on a small sanitation district board, and we were at a conference, and I was sitting at a table with some Trump supporters that was sharing that they were happy about this big ugly bill because it's taken from them. And so then I asked the question, what is it taken from you? Have you seen anything taken from you in terms of health care, in terms of services to your families? And the gentleman told me no. And I said, so why do you think this bill is going to be helpful? He was like, because then we'll be able to keep all of our services. We'll be able to have money in our pocket. So then I asked the question, do you have a family member that is disabled? He told me yes. I said, do you have a family member that may be using Head Start services? He told me yes. I said, do you have a family member that might be a senior that may be receiving food from the food bank? He told me yes. I said, these are all services that are at risk of being cut. And he told me it wouldn't be cut from him. I said, see, we only focus on headlines, but we don't read through the print, the fine print. It's going to happen to all of us.